February is American Heart Month, a nationwide observance that spotlights cardiovascular disease. Joining us now to talk about the importance of heart screenings is Dr. Michael Coords. Thank you so much for joining us. Good morning.
Good morning, Tony. Thank you for having me.
Okay, let's get straight into this. How common is heart disease in the U.S.?
It's very common. About 1 in 5 deaths are related to heart disease. It's been a leading cause of death for about 100 years. But this really only gives a small insight into how common it actually is. So if you go and actually look at for coronary artery disease in patients, about 50% of patients over the age of 40 will have some coronary artery disease. So it's extremely common, and we're really not doing enough to look for it early.
Yeah, I mean, I myself, I have high cholesterol, extremely high cholesterol, and so I even have to take injections for it. I try to eat healthy, right? That's what a lot of people do. Aside from that, what adjustments can we make to take action for this?
So there's a lot of things people can do for the overall heart health, and you had mentioned eating healthy. That's something that I hear very frequently, to eat healthy, and that's extremely important. But even eating healthy, if you consume too many calories, it becomes unhealthy. So maintaining a healthy body weight is extremely important. If someone's overweight, take small steps. You need to burn more calories than you're consuming. Take the small steps, take the slow wins. You didn't gain the weight in 1 week. You shouldn't expect to lose it in 1 week. But maintaining a healthy body weight is one of the most impactful things you can do for your overall health, including your heart health.
That's good to hear. Now, if you're going to the doctor, I mean, first off, going to the doctor is super important to check up
Right.
on your heart health, right? Should we ask for any type of screening? Can you explain the difference between those kind of scans that we might do for our heart?
So that's a great question. And, going to the doctor is really the first step. So if you're going to the doctor, talking about your heart health, talking about screening, you're moving in the right direction. There are a few different ways which people can screen for coronary artery disease. You have your traditional risk factors, people, family history. Most people have had a cholesterol test before, blood work. So you can look at it from that perspective. And if someone is going to their doctor and they're having blood work done, something that I would suggest that they do is talk to their doctor about something called lipoprotein A, which is a type of cholesterol that is by itself an independent risk factor for coronary artery disease. Highly genetic. Not enough people are actually getting checked out for it. But when it comes to imaging, one of the most effective ways to look at your heart and for coronary artery disease is with the CT scan. And the way that I like to approach it is you have good, better, and best. Good level is something called a coronary artery calcium score. This is a non-invasive test, only takes a few seconds, no dye or contrast needed. You go into a CT scanner, and about 5 seconds later, you come out, and you can see how much calcified plaque is in your coronary arteries. Is it perfect? No. But it's a very good data point when you take it in combination with someone's overall health, their family history, what their cholesterol level showed. So that's a very good test someone should talk to their doctors about. That's the good level. A better level is something called a coronary CTA. This is one of the best ways to look at your coronary arteries. This does require some contrast, some dye, but it does an excellent job at looking at your overall heart, your anatomy. You can actually look at all the amount of plaque that is there. So while a coronary artery calcium score at the good level looks for the calcified plaque, a coronary CTA looks for the calcified and the high risk non-calcified plaque that's more likely to cause a heart attack. And then when you get to the best level, that would be the coronary CTA with AI, vessel, and plaque analysis. So this is using software, does a great job at second set of eyes, looking at all your coronary arteries, characterizing and quantifying the amount of plaque that is there. So we have tremendous leaps in technology, both when it comes to CT scanner hardware, as well as the technology we use to analyze it. So just
Wow.
tremendous leaps in technology over the last decade or so.
Wow. Oh my goodness, that's incredible. And so important with it being the leading cause of death. I mean, I have a family history of heart health and everything, and so it's a big thing for me. So I'm glad that we're talking about this. Thank you so much for joining us and for all that information.
Thank you.
All right, have a great day.
You too.